Well, hello, and thank you everyone for joining this webinar hosted by the Munk School of Global Affairs and Public Policy and its Innovation Policy Lab. I'm Anna Maria Tremonti. I'm the host of the CBC podcast More, and I'm the former host of CBC Radio's The Current. Today we are going to talk about COVID-19 and the world's grand challenges. These are big issues. We have an hour, which is going to fly right by, so let's get to it. We are inviting questions from you in the audience. You can email us, tweet, or write to us in Zoom's Q&A field, and we'll get to as many of your questions as we can. Our panelists today: Joseph Wong of the Munk School of Global Affairs and Public Policy. He is the Ralph and Roz Halbert Professor of Innovation and also the University of Toronto's Vice Provost and Associate Vice President of International Student Experience and founder of the REACH Alliance. Anita McGahan, University Professor, holds the George E. Connell Chair at the University of Toronto. She is a faculty fellow at the Munk School's Innovation Policy Lab and on the advisory board of Grand Challenges Canada. And Karlee Silver is the co-CEO of Grand Challenges Canada, and her background is in genetics and immunology. Really important for today's conversation. Thank you for joining us. Thank you, all three of you. We have so much to talk about. I want to begin with that formidable phrase, the world's grand challenges. Karlee, what are the grand challenges?
Yeah, I think it depends how you want to frame it, but I would say that the Sustainable Development Goals are probably the set of grand challenges that the world has signed up to, guiding actions and commitments between 2015 to 2030. From our organization's perspective, we've taken a more fine lens within those Sustainable Development Goals and really identified some critical barriers or grand challenges that, if solved, and we use innovation to solve them, could really drastically change the shape of the planet in terms of our well-being and our health. And I think that some of the ones I'll pull up that I'm sure will permeate throughout our conversation today are around reproductive, maternal, newborn child health, and really making sure that we can focus in on sexual reproductive health and rights and the fundamental thing of that related to gender equality. There's grand challenges around mental health. And there's also interesting things that have to do with populations that are harder to reach. And I'll throw it to Joe here, but the idea of we're really focused on populations in conflict zones and how they are how they are getting the humanitarian assistance that they need across health, information, water and sanitation, and life-saving commodities.
Joe, do you want to pick up?
Yeah, sure. First of all, the Grand Challenges Canada initiative and its investments around the world have really closely aligned with the SDG agenda, and it's very timely that it's done so. And the REACH project, which is or the REACH Alliance hosted at the U of T, which is how I look at the challenges, the grandest challenges, if you will, as they relate to the SDGs, is how do we ensure that all of the terrific innovations that are being funded by Karlee's group and indeed being developed around the world, how do they reach those that are the hardest to reach, which is to say those who are at the margins, those who are at the base of the pyramid, those who are suffering from the indignities of the tremendous inequalities that we see around the world. And I think in many ways, and apropos this seminar, COVID has really posed to us or reposed to us, I think, the grandest challenge of all. And it really, I think, comes down to two truths that we know about COVID. One is that we are all vulnerable, which then means that this is really a global challenge that we all have to be concerned with. But that vulnerability is not experienced equally. And that's a profound, maybe even a kind of a contradiction, right? We're all vulnerable, but we're not vulnerable equally. And what that does is it really kind of explodes the way in which we think about how we would approach the Sustainable Development Goals, the grand challenges, and in the immediate setting, how we're going to respond to COVID.
Well, Anita, maybe you can pick up on that because these were already big goals pre-COVID. And I'm wondering how this pandemic has changed what you see and how you go forward.
It's hard to be comprehensive in an hour about all the different things that will have changed, but let me just mention three of them here. First, we are entering into a vast humanitarian emergency, especially in places where there's relatively low incomes, where there's a lot of vulnerability, to pick up on that idea that Joe was expressing. It will be imperative to save lives. I was looking last night at the map, the Johns Hopkins map of COVID cases in Africa. And you've got to believe that there's vast under-testing, vast under-reporting of COVID deaths. We know that because the infrastructure for doing testing for accomplishing this in resource-limited places is not as developed as it is in Canada and other relatively wealthier countries, that there has to be an incredible amount of untested COVID in these places, and that is going to lead to tragedy of unparalleled dimensions. The second thing that's changed, and it's interesting to hear Karlee talk about Grand Challenges Canada's mission of overcoming critical barriers. I think a lot of barriers are dropping by the wayside. We now know that it is possible to accomplish progress on climate change. The impact on the environment of our social distancing and shutdown and lockdown around the world has been unbelievable, and it's just not going to cut it anymore to claim that we can't make progress. We know we can make progress. And the same thing is going to be true about other arguments that in the past have been set up as resistance to trying to make progress on the SDGs, as Karlee suggested. Those barriers are gone. We're going to be entering a whole new world where the challenge isn't going to be, should we do the SDGs? The challenge is going to be, how do we innovate fast enough on the trade-offs between the SDGs to be able to, save lives on a timetable that's relevant, and to build capacity and resilience and reach those hard to reach populations. Because one thing we sure have learned is that the actions of anyone, anywhere in the world can have a global impact. In this case, it was someone in Wuhan, but if we leave one case undealt with, that could have long-term consequences for all of us.
You're touching on something that with profound change comes disruption and devastation, but also there are new opportunities in there. And I want to talk to you, all three of you, about those new opportunities. But before we get there, I want to ask a little more about what this does to the kind of work you need to do. Joe, you talk about the hardest to reach, reaching the hardest to reach, at a time when all sorts of movement is so restricted. How do you reach the hardest to reach?
Yeah, that's a great question. I think that, we are seeing now COVID exposing not only inequality that should have been obvious long before, but I think is being laid bare for the entire world to see. And it's not just inequality in terms of wage inequality. We're seeing different kinds of living conditions. We know, for instance, that it's near impossible to impose a lockdown when you're talking about very densely packed urban centers, slums, informal housing, people working in the informal sector who are living on a day-to-day, totally unpredictable wage basis, and so on. So we're exposing a whole new ways of thinking about inequality. I'd like to pick up on that point that Anita made in terms of the opportunity that comes here. There are tremendous opportunities for us to actually do a reset, not only a reset in terms of how we might approach climate change, but also a reset in terms of how we deal with infrastructure, how we deal with, so for instance, last year we did a terrific project on medical supplies delivery in Tanzania. It's not trivial when roads become dirt tracks 5 minutes outside of a city, and you're trying now to be delivering essential life-saving medicines and so on. So it allows for us to rethink what infrastructure looks like. I know Anita's working on a project right now on drone technology in Rwanda, which is actually being employed as a way of delivering medical supplies. It's extremely expensive. We have to think about it much more innovatively in order to get that done. It also allows us to do a rethink in terms of IT infrastructure and ways in which we can bridge the digital divide. This is turning out to be IT and information communication technologies more generally are turning out to be a potential game changer in terms of the platforms that we might be using. But again, unless we're mindful of reaching those who are hardest to reach, there are limits to how we can do that. So I think that what COVID's done is it's actually forced us to confront, the possibility for new opportunities. But to Anita's point, if you don't reach that last person, if you don't reach that very hardest to reach, the transmission of COVID has proven to be so easy, so that we're all so vulnerable in interconnected ways. If we're not actually casting our net wide enough to reach those who are hardest to reach, we make ourselves all vulnerable ultimately. And that, I think, is a really important lesson that comes out of this.
There is that phrase, we're all in this together. But as you point out, that may be, but together means many different things depending on where you are because of the inequality.
Yeah, absolutely. The work that Karlee does at GCC, I think one of the things that also comes out of this is the real direct connection between economic development, prosperity, and health. I mean, all too often we frame these things as different things, and this is a group that doesn't need to be told this. They, folks on this seminar and those patching in clearly already understand this. But the linkage between health and economic development and prosperity can't be made any more clear than what we're seeing right now. As people become unhealthy, economies are becoming devastated. And so another opportunity actually is for our policymakers and our thought leaders to link those two more closely together, to recognize that investments in health is an investment in the economy, and investments in health in the global south, as global supply chains are being reconstituted, is an investment in our economy. So, I think there are some real opportunities here amidst this potential crisis, amidst this current crisis.
I just want to let our audience know that you can put in questions. You can email or tweet, or you can go to the Zoom Q&A field and type your question there, and it will get to me, and I will put it to our three guests. Anita, you deal with the intersection of the, business, industry, global health. And sometimes I feel like that intersection is a bunch of threads that have all been balled up. And, as we try to separate things and figure out where to go, what are your thoughts about that intersection and moving forward?
I think we're at a place where we're facing a whole sea change in our mindset for what constitutes health, what constitutes appropriate economic development, and what constitutes the network of global institutions that we need in order to make us locally strong. So if I may, I want to just put a couple of things on the table that I think are going to be true as we move forward into this second phase after restrictions start to be relaxed. We have to go back to work. We have to find a way to get children back in school before we have a vaccine. And a lot of the compelling argument for that really doesn't relate to people such as me and my colleagues. It relates to people who are very vulnerable. So let me just say that we know that when people are desperate, when they need food, when they need the basics of life, when they need shelter, when they're worried about their children's health, that they will do what it takes in the short run to be able to meet those needs. And the world is going to have to support meeting those needs, basic medicine, basic education, getting people the food security that they need, getting people their fundamental rights, their human rights acknowledged and supported from afar. So we have to figure out how to intervene and support local action in communities to try to make sure that we don't have conflicts erupting around COVID, that we don't have people cheating on the rules or not obeying government guidance on social distancing, and creating these enormous flare-ups, these enormous infection rates in places of poverty. Very worried about, for example, people living in insecure housing in the slums of Delhi, for example, you know, and having enormous sort of ununderstood, misunderstood disease emerging in those areas. And the private sector has an enormous role to play in this, and is going to be confronted with an awful lot of change, permanent change, as a result of COVID.
Karlee, do you want to pick up on that?
Yeah, I do actually. I want to bring in, like, I think the media really right now is telling us a lot about this dire situation that that is facing least developed countries in Africa and other parts of the world. And I think there's a real caution story to that. The health numbers that we're seeing, the numbers of COVID are still slow to come up. Lots of that has to do with lack of testing or lack of reporting. But there's also the impact right now is much more on the economic side of it that Anita was just referencing, and the ability for us to come back from that is probably something we have to be as concerned about as the health implications. But I also want to bring in a little bit of an optimist view on this whole thing. I mean, I've been in the innovation for global health game for a decade now, and I've never seen the attention on global health that we have right now. And I think this is going to advance some of the agendas like we were talking about before in the SDGs. As an example, prior to COVID-19, we at Grand Challenges Canada had a portfolio of projects that were focused on access to medical oxygen. We really picked this up because 800,000 children die of pneumonia every year, and oxygen therapy is a key part of treating them. And yet, around the world, the availability of medical oxygen in most facilities that needed to be addressing childhood pneumonia was appalling. It was poor quality, it was unreliable, and it was expensive. And even when it was there, because of those other underlying things, it was often not even used, or it was rationed by the healthcare setting or healthcare providers. Medical oxygen has only been listed as an essential medicine since 2017, which is kind of wild to think 3 years ago. And right now, medical oxygen therapy, not even the ventilation part of it, but just having medical oxygen is necessary to treat severe COVID-19. And so the demand for oxygen is through the roof right now, in a way that the urgency of it, the real linkage between this pandemic that we're seeing and the need for this essential medicine in every facility, health facility in the world, is enormous. And so governments, for the first time in a long time, are actually prioritizing investments in medical oxygen. And so one of the examples here is that, like, plants that have strategically put themselves in places where their distribution networks are much more efficient, and they can actually provide quality flows of medical oxygen away from industrial areas. So lots of the countries that we deal in would necessarily have one kind of core centralized industrial area and a whole swath of hospitals around that wouldn't necessarily be able to access the oxygen. Now we have solutions like Hewetele, which is a for-profit social enterprise that serves several COVID-19 isolation hospitals in Kenya. Before the COVID pandemic, it was at 50% capacity. And over this time, it's had investments that have been boosted, so now it can be working 24 hours around the clock to be providing medical oxygen. And this idea, when COVID is done and when we've figured out how to solve this through vaccines and other things, that medical oxygen will be there to help the children that are still dying of pneumonia, and will be there for the surgeries that are needed for C-sections when moms need that for emergency obstetric care. And I think this link to what we can do right now and where the appetite is to be making massive investments that actually can accelerate our progress towards the SDGs is one that we cannot ignore.
That's a really good example of the infrastructure then that can be put in place and can continue to be used. Go ahead, Joe.
Well, as I've been thinking about this since the onset of COVID and thinking about the global implications, I find myself on any given day leaning towards an optimistic scenario And then the next day, usually reading the New York Times and the headlines, and then I find myself in a pessimistic scenario or reading the Guardian development section. But part of me does. There is a skepticism here as I think about this, because I agree with you 100%, and I'm sure everyone in this room agrees with you 100% that now more than ever, global health should be on the agenda, and indeed, I think in the minds of many, it is. But there is a politics here, and I mean, I'm a political scientist, and so I'm maybe too acutely aware, or maybe too acutely attuned to this, and maybe even too sensitive to this. But when you have the most powerful country in the world defunding its commitments to the WHO, when you see a tendency now of an inward-looking populist politics not only occurring, but actually really gaining some traction in some places around the world. Now, it's being mitigated by some counteractions, but that nonetheless it exists. It leaves me to thinking that we have to think beyond this particular moment, and we have to start making a much more sophisticated case as to why continued investments in global health and the redesign of global health institutions are required. Unfortunately, we have short memories. SARS was here in '03, and one of the main recommendations that comes out of that is surge capacity. That is a recommendation made around the world. And it wasn't that long after that we kind of forgot those lessons, and we find ourselves now making very, very constrained, allocated decisions in the absence of having any built-in surge capacity within our own jurisdictions and internationally. So again, the opportunity has arisen, and Karlee, the work that GCC is investing in is giving us the proof points that indeed investments today will have effects that will redound into the future. But I still think we need to make the case. I worry that people are going to forget, and we will have lost this opportunity.
Karlee wants to jump in on that. Go ahead.
Yeah, I do. I agree with you, Joe. I think where we need to start going now, though, is understanding, like, how are we, not only is the problem a universal one, we all understand that a virus doesn't carry a passport, it's not queuing up at a border, and that all countries and people are going to benefit from approaches to limit disease in parts of the world, especially infectious diseases. And so that's kind of one reason why we might keep investing. I think there's lots of examples that are starting to pop up now of things that actually have been invested in for the constraint, the resource constrained areas that other parts of the world offer that are actually coming back to the Canadian context to help us here. So one of the examples here is we supported an enterprise called WellTel in about 2013. And there's a digital health solution for people. Initially, it was focused on people living with HIV in Kenya. And it was focused on how do you manage a chronic disease situation, monitor people who are needing to be close to health society or health services, but are actually fragmented from it. They've now flipped this, and it's being rolled out in BC, in the UK, and then again in Kenya and Rwanda to focus on managing COVID and managing health conditions during social isolation during this moment. And so this is an example of an investment that was actually made under international development that has now come back and is serving the Canadian population. And I'm seeing more and more of this where we become open to innovative solutions that are actually, we're able to do some things in other parts of the world that are much more creative. And in these moments where governments are weighing the risk against massive population health declines and potentially a little bit of a riskier solution that no one's tried before, they're going for the solution in a way that I've not seen before. And I think there's something we have to pay attention to and kind of counteract that nationalistic view. And how do we be open to actually insourcing things from elsewhere?
Well, it's interesting that you use that example, because I was just about to give you a question. Shiri Bresnitz has written, even before, but more after COVID, we saw many countries and organizations have been focusing more on national needs. So you give that one really good example. But how do we get people like the public who responds in all sorts of different ways, but also politicians to understand the need for a worldwide solution. Who wants to tackle that? Anita, go ahead.
Thank you. So first of all, I want to put a couple of numbers on the table, if that's all right, just to scope this out. I am enormously compelled by what Karlee and GCC are doing, and feel thrilled to be a part of that. And I'm so appreciative of the optimism that GCC creates for all of us. And yet I also want to put on the table that we are facing a challenge of unprecedented scale that is going to cause us to really rethink what health and what global health are, you know. And just to put some numbers on that, the United States, I believe today, is going to announce a 15% unemployment rate. We know that economic activity is down about 30%. We know that this has hit hardest on people who are relatively low income, not just elsewhere in the world, but in Canada and at home. We know that there's an enormous strain on government money right now, that the borrowing is going to have to go up, the taxes are going to have to adjust to reflect the expenditures that our governments thankfully are making to try to create coherence in our lives. There are also incredible advances conceptually on our understanding of what constitutes health. And already the discussion has alluded to some of these. You know, sometimes the best investments in global health are putting in paved roads. They're putting in sanitation systems at scale, large sanitation systems. It's just untenable that, you know, large numbers, billions of people in the world are drinking unclean water or are at risk of not having access to a basic education. We have to innovate in ways that do not require the transportation of a lot of people across international boundaries for two main reasons. The first is that those are vectors of infectious disease, transmission of disease. And the second is it's not scaled to the scope of the problem. The problem is too large for us to rely on some of the old central mechanisms of global health interventions that are very labor intensive. We're going to have to innovate through IT and so on. We're going to be moving into a period, I think, in every economy of much more localness, much less international travel, much more, you know, taking care of ourselves. And we have to figure out how to innovate at a global scale at the same time, where what's being transmitted across boundaries is not so much people as knowledge, ideas, money, information. You know, one of my most profound experiences as a global health advocate was going to a place where there were, you know, tens of thousands, if not hundreds of thousands of people living in a tent city. And there were two doctors. And I thought, never have I been to a place where there's so much human capacity and so few trained health professionals. That has to change. We have to take advantage of local capacity in ways that we haven't thought through. So just innovating in the concept of what constitutes global health is going to be important as we move forward.
Well, and let me pick up on that point, because you all believe in the importance of being there. And, you know, Stan Zlotkin has sent a question: how do we measure vulnerability and hunger, let alone move forward with how to tackle this, given that need for physical distancing and given the restrictions on travel? I've paraphrased a little bit of what I've added the travel question there too. I mean, because how do you be there at this time?
You know, I think that's a question. I want to say that Stan is a beloved member of our community. He's also an advisor to Grand Challenges Canada and part of the REACH project with me and Joe. And I want to say, Stan, that was a question we were going to ask you to help us solve. These are the innovation challenges of our time, is figuring out how to accomplish something like that.
Go ahead, Joe. Go ahead.
I think Stan's question, and indeed one of your earlier ones, Anna Maria, gets to a point that Anita makes, and I think it's worth reemphasizing, is that, you know, that what we've seen, for instance, in the REACH project, is that there are core principles, there are core models, there are core ideas, there's core knowledge bases, and so on, but that it has to be flexibly deployed around the world. And the flexible deployment really does come down to local capacity, local ingenuity, knowledge of local context. And so I think there's actually less as we focus more on local efforts to address these situations, there's probably less of a role for us to be getting on planes. I'm sure, in fact, there's probably many folks in the world who would like to see less of us on planes for a variety of reasons, not least because folks on the ground know exactly how to flexibly adopt ideas and knowledge and capacity. But that's a capacity question, and that, you know, it requires us to be making investments in those capacities.
Can I just also briefly add, I think we need a new investment and a new mandate for global institutions like the WHO. Joe and I and others have been thinking about a health stability board, analogous to the financial stability board that was created after the financial crisis in 2008, 2009. You know, one of the reasons that the WHO is vulnerable to an action such as happened in the United States, my home country, is because it's not part of an interlinked set of international institutions analogous to the financial system. You know, it would be completely unthinkable to withdraw from the international financial community or any one of its core institutions, such as the World Bank, the IMF, or you know, any other global financial institution, because it would trip off a country's consequences for a country that would ripple through the entire system. We need the same thing to be true about healthcare. We need to create a global body that will go in, try to create local capacity, and then advocate for when a country has developed, you know, kind of core infrastructure for things like harmonizing medical training and licensing people from that country to practice medicine elsewhere and vice versa. And that can work in tandem with the WHO and strengthen the WHO's voice here. But, you know, really rethinking and rebuilding global health institutions to have that kind of depth that we have in the global financial system is critical in my view.
Now, Joe, I know you want to step in on that, but
Yeah.
I've got a question for you related to what Anita is saying right there. And that is, in the midst of all of this, we see world leaders who are questioning these global institutions. And, you know, there are questions of accountability that can be legitimate, but there's also the undermining of these institutions, like the WHO, that going on. Do you see political will amongst world leaders to actually move forward in the kind of way that Anita is suggesting?
It's a terrific question, and I think it's one of the big questions that we need to address. And for those who are in positions to be shaping opinion, need to really be investing their energy and creativity and ingenuity. And I mean, in one sense, as I was listening to Anita talk about the various circumstances that we're seeing, not only in the global South, but even in the US, these things that are untenable, they were untenable before. So it's not, and we all know this. I mean, this panel doesn't need to know to understand that what was untenable, unacceptable, immoral was occurring before. And the question now is, refracted through COVID, are we going to come out the other side and say and agree as a global community that it is even more untenable now, and that's a call to action? Or do we see the opposite, which is what I do worry about, is that countries are in fact looking more inward. They are concerned about their own national needs, as they should be, but at the expense of any notion of any kind of global cooperation or coordination, like the stabilization board that Anita just introduced. I mean, we look, for instance, at the vaccine development race that it is now, and this is very concerning for me, in the sense that I'm actually looking at where are these biotech firms located, who's investing in them, and I'm, you know, I'm happy to know that the Canada Pension Board is investing in one biotech firm in Massachusetts. But then I immediately started asking myself, where's the distribution channels going to come from? How is the retail, or how is the allocation going to be determined? Will we in Canada have access to this? So these kind of nationalist overtones become very prominent very quickly, and even in globally minded people such as myself. So two things as we move forward where I think we can be investing our energy in. One is, again, making the very explicit link to the economy. One of the reasons why I think we've taken to heart lessons around that come in the wake of the global financial crisis is because the economies were hit so badly, and so that it's in everyone's interest to be to ensure that we're addressing this collectively. Making that link to the health situation and the pandemic right now is absolutely critical. We're all hurting, and we're all hurting together, and any chance of recovery is us cooperating and collaborating together. The second thing is just leadership. You look at the formation of international organizations in the post-war period, they were all heavily invested with global leadership. And we don't see that now. The countries that we are looking to for global leadership, and indeed the countries that are competing notionally for global leadership, countries like the US and China, are not stepping up. They're fighting their own trade wars. They're talking about strategic decoupling global supply chains. They are, they're fighting a diplomatic battle between each other, and the rest of the world is essentially being held hostage as the notional leaders of the global community aren't getting their act together. So unless we have some real concerted global leadership that is principled and ethical and influential, I worry. And I think without those two pieces, the link to the economy and strong leadership, I worry that this is something that is theoretical.
Do you see strong leadership somewhere? Like, what are you watching?
Well, I'm watching for some notion, for instance, in the vaccine development, I think will be an important litmus test of this, where there is some sense that wherever the vaccine is developed first, that there's a commitment to a global allocation strategy to get those vaccines to those who are most vulnerable. And I say it's a litmus test because that's a very high bar. It's very easy right now to actually be indifferent to the rest of the world. It's very easy to be indifferent to, if you're in the United States, very easy to be indifferent to those just north of you and just south of you. Just imagine how easy it is to be indifferent to countries in sub-Saharan Africa. Can you imagine? I could imagine some in global leadership circles saying, well, the best way to ensure that we're not affected by what's happening in sub-Saharan Africa and other parts of the developing world is to just close them out. I could see that happening, and that's one way in which this could potentially go. And indeed, on any given day, the politics is telling me that that's indeed the way it may go.
Karlee, you want to jump in on that?
Yeah, I want to jump in just with like bringing back one of these concepts of the vulnerability in this conversation, because I think one of the things that was there before and that seems not to be part of the solution yet, but should be, is this concept of gender inequality. And so we're talking about like this global thing, and we often think about these vulnerable or hard to reach people who are excluded from the solutions as being elsewhere. And I think what we're learning through all of this is that there's a lot of inequalities that are right within our populations themselves. And a really good one here, as we're talking about leadership, is that if you think about some of the stats that have come out for women's representation in the decision-making around COVID-19, we've only had 20% of the WHO Emergency Committee on COVID-19 being women, whereas 70% of the global health workforce on the front lines are women. And as of February, so early on in the pandemic, for every three men quoted in the media about COVID outbreak, there was only one woman. And so there's an interesting impact of this in terms of like, we're missing out on some critical expertise at the table. We're missing out on some of the gender dimensions that exist in an outbreak and a response. And we're probably going to be overlooking some really critical things, and maybe even half the population being part of this solution. And I think there's some really interesting ways that we're already seeing signals of hope. If anyone's been following what they're trying to do in Hawaii, where they've got their plan to rebuild is actually fundamentally rethinking how their society should be working when it comes to gender equality. They're looking at instituting the they're instituting universal basic income. They're looking at increased minimum wage for single mothers. They're looking at free publicly funded childcare for all essential workers. So these concepts that are emerging from COVID and who is bearing a lot of the brunt can actually really get back to some of the ideas that the SDGs was trying to get us focused on, in a way that, here we go, like our entire world's going to have to rebuild economies. Could we maybe take this opportunity and make sure that next time around our political leadership might be a little bit stronger so that we could do better?
It's interesting. The Armin Yalnizyan, the economist in Canada, has said that this is a she session, and other people are saying it now too. That this is affecting women economically, health-wise, frontline worker-wise. And so with all of that, and with that understanding in Canada, Neelam, Betty has a question: how can Canada lead the way on coordination at the international level?
Well, I think that Canada has always occupied a position of ethical leadership. We've always punched above our weight in diplomatic circles around the world. I think that when Canada and the coalition of the principled speak, and Canada, I think, has a loud voice in that, people listen. And I think there is an appetite right now for that kind of principled global leadership. The key is ensuring that there is a coalition of the principled, that it is truly global in scope, so that it's not just a G7 or an OECD club. I think that would have a kind of flavor to it that may be distasteful to many around the world. And I think that the message has to be consistent, and it has to be globally inclusive. And again, the opportunity here is to link it to the global economy. Look, remittances are down right now. Remittances are an important source of daily income for many of those who live precarious lives in the global south. It's down 20%. These are flows in the economy that just are indications of just how we need a globally inclusive a message. And also, to Karlee's point, I think there comes a point in the discussion around any crisis that the lessons learned from the crisis are not lessons learned solely to deal with crises, but rather that we can build this into our new normal as a way of creating resilient governance structures. And so the investment in an international health stabilization board or new international institutions aren't just there to address crises, but are rather there as exemplars of resilience to prevent crises in the future. So a universal basic income. Yeah. I should hope that this would have more traction now than ever before, but it will have more traction if we think of it not as just a response to the short-term costs of the crisis, but that this in fact raises the floor, as investments in primary care and so on, raises the floor so that we are just much more globally resilient. That's the message, I think, that we need to get out there. And of course, the messengers, Canada's in a perfect position, I think, to be one of those messengers.
Anita wants to jump in. Go ahead.
Yeah, I mean, I agree, and I want that to be true. And at the same time, I think it's not going to be compelling unless we do it at home first. In other words, okay. Canada has a very persistent gender inequality profile, and we're not going to be able to sustain that voice, that moral leadership internationally, unless we deal with the problems at home. Now, there's a number of policies that I think are no-brainers that Karlee and Joe have both mentioned, including childcare, supports for single parents, and so on. But there are also real structural issues in the way that jobs are organized that and problems associated that with our even education system that drive women and girls into particular professions, particular settings, and we need a comprehensive plan for addressing that if we're going to have the kind of legitimacy on the global stage that Joe is describing, and which I also thoroughly support and endorse. But it's going to be this is going to be true of almost everything we do. Some major things coming out of COVID are going to be, we're going to have to do it locally and globally innovate on both fronts at the same time and be better at what we do on both fronts at the same time. We're going to have to move from models of efficiency and trying to drive costs relentlessly down, and using global interconnections and debt and so on as mechanisms for pressuring leaders and managers into keeping costs down to the bone, to starting to build for capacity and resilience. And a lot of that capacity and resilience will come from better mechanisms of sharing ventilators and essential health equipment across jurisdictions and things like that. So there's going to be a lot of work to do on the ground in coming up with new global systems that can be integrated with local priorities to reallocate resources more efficiently, because all else equal, the economy is down 25% in terms of the activity from what happened pre-COVID, and that is an unprecedented shock that we're going to have to be contending with for a long time.
Well, and you mentioned the importance of education. Rhonda Freeman has a question here. Will access to higher education be affected because of rising student debt and costs incurred by colleges and universities?
Joe, you're our associate provost.
All indications suggest that, at least at the University of Toronto, we're not expecting this, but I think that we are seeing, we're seeing the lifting of the veil, and we're seeing some deep structural inequalities that are embedded in our societies and how they're manifest in our colleges and universities. I think every university right now, every college is thinking about how do we continue to make post-secondary education as accessible as possible, not just on the tuition front, but just how you engage with the university in the time of COVID. This is not a trivial exercise, nor is it just simply the purchasing of a device. It's about changing the way in which we teach. It's about changing the way in which we fundamentally engage with our students. So again, there are opportunities here for universities to improve on that front. But I also think, the role of the university as an institution in pursuit of the kinds of missions that we've outlined in this panel is more important than ever. It is one of the University of Quebec institution is one of the most globally networked institutions that is nonpartisan, that is driven by the pursuit of knowledge and the betterment of all societies. And so I'm actually, when I read about research into vaccine development that's being led by universities, in which you have PIs that are principally committed to sharing their research so that others can learn from it, and principally concerned about ensuring that those who are most vulnerable benefit from that research. I think that's not just a reflection of the expertise in the universities, it's a reflection of the principled commitment that the university has. So access to post-secondary education is even more important than ever before, as far as I'm concerned.
I want to get through a couple of other questions here as we wind closer to our time limit here. Mina Akrami has a question about mental health. And Karlee, you were talking about mental health goals. With the digital divide, how do we, what do you think about access to mental health support when mental health support in some countries has become virtual?
Yeah, it's great. I would argue at the moment that the fact that the mental health services are becoming more widely available here at home in Ontario over the last little while because of the use of online services and things is a benefit. And I think the trick there will be actually how do we keep it when COVID, where the social isolation requirement for the remote access is gone. I think that the access to digital mental health services is something that needs to be way better invested in worldwide. In most countries of the world, you've got a treatment gap that's over 90% of the people who need mental health services cannot get them. And most of the time it's because there's no skilled providers and the ability to actually task shift a lot of the things that a psychiatrist would do to other workers in the healthcare system or even in community settings has been demonstrated as really viable options. And I think the trick now that we're seeing, we've been in this space for about 8 years now and investing in some of the most innovative work in mental health innovation in low and middle income countries. And there's still a very small reliance on really effective mental health services being delivered over either text messaging, voice messaging, or smartphones. And I think the real thing that's slowing it down at the moment is the trust in those services that can actually support a lot of the early kind of mental illness, moderate and mild mental illness, and can actually refer into the severe care when needed. But I think there's a massive thing. I think some examples of this are Anuka Hero, 7 Cups, and Friendship Bench, one we've invested in a lot, came out of Zimbabwe and is in multiple countries of the world, and really like physical wooden bench with grandmothers sitting on it has launched their digital version free of charge for people in Zimbabwe as a response of COVID. So again, I think we're seeing advances in mental health. I think this is one that is going to pick up quickly in the aftermath. We're thrilled that we'll have a call going out in 2 weeks on youth mental health in low and middle income countries. So if you've got any innovative ideas, stay tuned and let us know about them, because we've got some funding to back that up too.
How do we keep public health front and center after the acute period has passed? That's a question from Ed Schatz.
I think the acute period is going to last a while. We're going to be fighting COVID until we have a vaccine, and that's going to take a while. And, you know, what do we mean by having a vaccine? We mean having one that works and then one that's comprehensively available. And I don't think that this disease is going to be the only coronavirus that could threaten us. You know, the real health consequences after we have a vaccine are going to reflect the kind of pain and suffering and trauma that we've all been exposed to and are vulnerable to, but that others, presumably people who are not behind the glass screens here talking on the Zoom call, but others who are frontline workers, essential workers, and low income are feeling. Imagine the kind of vulnerabilities that each of us feel, amplified 100 times over. I'll share with you that last night I awoke in the middle of the night with a nightmare, and I never have nightmares, ever. And it just reflects the kind of deep impact that this kind of crisis, you know, has even on someone who is so privileged and has so many resources. Imagine if, you know, you're vulnerable in 1,000 ways, you know, and there's a lot of vulnerabilities that we haven't talked about, a lot of ways in which people don't have equal access to the kinds of systems that I would have access to, you know, based on gender, based on race, based on income level, based on various types of insecurities, such as being of immigrant or refugee status, lots of different challenges that face different people in the population that are going to be health challenges after the disease, even after the vaccine comes through. So this is a big deal. This is going to last years, and it's going to require developing and innovating and even really thinking about what health is differently. Elder care is going to have to be completely rethought, for example.
You know, and I'm looking at the time, and I see you each want to pick up on that. So I'm just going to ask this question to get you to pick up on that. And that is, like, we are really looking at something that has a very long tail, and we're not sure where that tail's, what it's going to hit and what it's good. So I'm just wondering if each of you can talk a little bit about, given the politics right now, we see a resurgence or a real vocal side of nationalism, given the economic realities, and also what that means going forward in terms of tax policies and public health policies. What are you thinking about down the road? Like, what do you want us to think about, each of you, as we look forward? Because this is not something we just go, oh yeah, that happened last month. This is going to be with us in ways that, you know, that I can't imagine, but you can. So who wants to, maybe Karlee, you start.
Yeah, sure. I mean, my head really goes to the women that are getting pregnant now, the young women who are not receiving or accessing contraceptive care, and the people who are actually not even looking for warning signs for heart attacks and things like that, and coming to seek care. I think we're going to start to see, and there's some reports of it now, of how much the non-COVID health implications are going to come out. People who have avoided the healthcare system for the last 2 months, but this goes down to kids that are not being vaccinated. You're going to get measles recurrences and stuff. We're going to have to we're going to have to look at this, because the deaths and the disease that is going to come if we don't also pay attention to the rest of the health complications that exist in the world, and only focus on COVID over the next little while, the deaths otherwise are going to massively outweigh what COVID's health impact is. And I think that's something we're gonna start seeing more reports of, and something we have to seriously grapple with. So it's all about the primary health care and going back to what the core elements of universal health coverage tell us. Us in Canada, we're very lucky. It still can be better. But this is something that a Canadian leadership on could be really critical as we go forward.
Joe Wong, what do you think?
So let me go back to the point that I opened with. What drives me crazy, like really drives me crazy in current conversations around COVID, is everyone saying, well, we're all vulnerable. Like when we, that at home together and you're watching celebrities and it's like, well, Tom Hanks has COVID, the world, you know, clearly everybody is vulnerable if Tom Hanks has it. And it drives me crazy because I think it glosses over the fact that while we are all vulnerable, there are many who are more vulnerable than others, and there are structural reasons behind that. And so on one hand, it makes me sad that that's the state of the discourse. But I also see the potential, and as a political scientist, I see the potential opportunity there. Because what we have going forward actually are, again, those two truths that I began with. We are all vulnerable. So there is a notion that there has to be some kind of collective response. And we also have another political pressure, which is to say that we're not equally vulnerable. And so you have the zero-sum kind of political pressure that might emerge from that. That's actually pretty rare, where you have both political pressures acting at the same time, and in fact, in complementary ways, right? So because we're all vulnerable, we need to be sure that those who are most marginalized are also being taken care of and are also inclusive of a global solution out of my own self-interest because of my own vulnerability, while at the same time attending to and recognizing the structural inequalities that are in place. If managed strategically and well, that could actually have a longer term political effect in terms of the kinds of resources and normative investments that we would make in something like this. So what drives me crazy may in fact actually allow for some political possibilities that we hadn't actually recognized before.
Interesting. Something to think about there. Anita, I'm going to give you the last word.
Thank you so much. And let me use my role here to thank you, Anna Maria, for leading us in this conversation, and to my colleagues. I'll just mention three brief things. The first is that we're going to go through a period, 12 months or so, until we get a vaccine, maybe longer, where we're going to have to do aggressive contact tracing and testing and really focus on managing cases that come up. That's going to raise fundamental questions about privacy and monitoring. The second is we're going to have a core restructuring of many industries, including the healthcare industry. And we've talked a little bit about telehealth and mental health. There's a lot of other dimensions of that. And then the third is that over the very long run, I think we're going to face a whole change in mindset on the way we invest and engage with each other in economic activity and the relationship between economics and health. So thank you again for leading us in this discussion today.
It's terrific. Thank you.
Well, thank you for your thoughts. There's a lot to think about there. I'm going to end with a question that I can answer. This one is Rachel Sylvia is asking if this webinar will be available after, and the answer is yes. A record of this panel will be available on the Munk School's YouTube channel tomorrow. So you can visit this and other Munk School online events. Thank you, Karlee Silver, Anita McGahan, Joe Wong, for your time today and for your ideas and for your work. And thank you everyone for joining us. Bye-bye.
Thank you.
Thank you.